Hello there. Welcome to yet another show of Fit with Mithraas. Fit with Mithraas, we've been seeing head to toe to heads with Sasikala, physiotherapist. So we would find out what we are going to look today. What is it that we are doing, Sashi, today?
So we have done with total hip replacement.
Yes.
So going little above. So I'm going to talk about sacroiliac joint.
Sacroiliac joint. Okay, where is that?
So pelvis bone, the top surface of the pelvis, that is iliac, and the spine or the end, that is sacrum. It is a fusion of 5 bones. And there is one more little part, that is coccyx. That is a different subject we will talk about later. This sacrum and the connecting point with the ilium. This is called sacroiliac joint.
Okay. So what அதில் எப்படி வலி வரும் எதுக்காக அது பண்றீங்க?
Again, it's the overweight and during pregnancy. So during pregnancy there is loosening of ligaments and the joints will become little delicate. So appo vandu pain ago, and it for women it will naturally give way so that there is for the easy pregnancy and the childbirth kaga. So delivery kaga there is natural scenario this happens. And apart from that there are other factors as well. Other contributing factors will be some like arthropathies, அதாவது மற்ற விதமான bone related diseases like ankylosing spondylitis, and the மாதிரி metabolic arthropathy. So multiple joints involve ஆகுது. So all that will involve this sacroiliac joint. So இது வந்து like sacroiliac dysfunction னு பார்க்கலாம், இல்லைனா sacroiliitis, that is inflammation.
Okay, இதில் வலி வந்துருச்சு அப்படின்னா will that lower back pain or it will radiate to the back, or how do they know that?
Yeah, very good question. So not all back pain is spine originated or disc originated or nerve impingement அப்படின்ட்டு இல்லை. But this is also a back pain, but it is the origin is from the sacroiliac joint. So in the pain வந்து it will radiate sometimes in the front part of the thigh or the back of the thigh and hardly to the feet, but sometimes even till leg, but not the feet. So it depends upon the muscles that get weakness, and the corrective part will get the pain and weakness. So the correlated part.
Okay, so you have simple exercises for this also.
Yes. Okay. So we have very simple and effective exercises which needs a lot of mind and body coordination. So very mild movements, at the same time it's going to be
because in the pain they can't do.
Yes. So this is not something we can easily manipulate. There is something called rotation or counter rotation, so of sacrum. So all that we will do in manipulative or mobilization part. So adula pannu. But home based exercise பார்க்கும்போது there are a few 4 exercises. That too it is not a visible contraction like நம்ம biceps dumbbells எடுத்து பண்ற மாதிரி, or triceps workout or leg curl or whatever. So this is going to be I'm going to show simple isometric contraction. So when there is pain, the movement will be affected. So வலி இருக்கும்போது நம்ம மூவ்மெண்ட் செய்ய முடியாது, range of motion will get reduced. So at that time I'm going to talk about isometric contraction.
So okay, then we'll see the exercises with Sasikala. All right.
Sir. So initially I'm going to show how I'm going to clinically assess and diagnose the condition. So it is just for general awareness. So all these diagnoses are not necessarily to be followed at home. Now I am going to show how to assess the sacroiliac joint. It is just a very simple method. Slowly down this figure of 4, and I'm just going to stabilize the opposite hip and slowly, keep your hip stable. Slowly push the knee down so that there is pressure on the sacroiliac joint. Now I'm going to repeat. Okay, now bend your leg like figure of 4. I'm going to push the thigh down, holding the opposite pelvis. So this amount of pressure is going to test the sacroiliac joint of the right side. So any test will either provoke the signs or will relieve the sign. That is how we are going to physically test and confirm the sacroiliac joint pain. So now this is a kind of bone to bone contact, that is sacrum and iliac, and if the pain is provoked, the sign is positive. Now the next is come close towards the edge. Yes. So now I am going to push one lower limb, that is one whole limb down. This kind of rotation is going to physically give us the symptoms whether the sacroiliac joint is affected or not. So usually either one joint is affected or both the sacroiliac joint is affected. So that we have to rule out, which is actually working out. Now do side lying. Now it's the direct pressure I am going to give to the sacroiliac joint. So this is pelvis and here is the iliac bone, and which is connected to the center spine. This junction is sacroiliac joint where we see the dimple on both the sides. Now I am going to give pressure. So the direct pressure, if it's increasing the symptom, which means the test is positive. Now lie on your chest. Lie on your chest. The same way, direct pressure on the sacroiliac joint. Will clinically shows the results. Now next I am going to show the exercises to relieve pain from sacroiliitis or the sacroiliac joint dysfunction. So these are isometric exercises. Slowly come down, still down. Okay, to the center. Okay, so isometric exercises, which means there is no movement but still there is maximal muscle contraction, that is shortening of the muscle fibers to the maximum. So here now I am going to ask both hip and knee to be bent at 90 degree. Now she is going to give pressure against the thigh. She is going to push the thigh down and I am just giving the counter force. So in this way it is going to benefit the sacroiliac pain. Hold for 20 seconds. Yeah, relax. Next, bend both the legs. Now I am going to give the medicine ball to hold between the knees. This is again an isometric exercise, which means there is squeezing the ball between the knees and there is no movement. At the same time there is contraction. Squeeze the ball without holding your breath. See, flatten the back, tuck in your tummy. Now squeeze the ball without holding the breath. So I have left the ball and she is holding it by isometric contraction. Yes, thank you. Next, with the exercise band. Now I'm going to show with exercise with the loop band. Bend both the legs. Yes. Keep the legs bent. And now slowly make the knees wide apart. apart and sustain the position by isometric contraction. So when there is a pain, instead of like a concentric or eccentric movement, the exercises without obvious movement but muscular contraction is beneficial to the painful joint. She has not relaxed the muscles are still in contraction but without movement. Now slowly relax. Yes. Shall we take off the loop? Now lie on one side. Yes, keep the back knee bent. Okay. Now the forward leg slightly bent and just slowly drop it forward and up and kick out and drop down. With knee straight, just lift the leg up and slowly drop it down and kick out, kick and down. Now do it on your own. Up, bend and drop it down, kick out and drop. So this is an exercise which is going to bring more exercise and movement between the sacrum and the iliac bone, that is sacroiliac joint. Yes, thank you. And now lie on your chest. Lie on your chest. Ulta. Yes. Now I am going to show heel prop. Okay, with upper body relaxed, hands forward, lying on chest. Now she is going to lift the thighs up, slightly up, so that there is no arching of the back. Up, minimal movement which is limited to the SI joint. Now down, up, down, up. So I am just supporting her and she is doing it on her own. Okay, thank you. Now I am going to show hip flexor stretch. Just stand shoulder width apart, one leg forward. The leg I am going to stretch, just taking it back and pushing the thigh back as far as possible, leaning on the forward leg. So this is going to relieve pain and it is going to bring some rotation in the sacrum. One side it will be anterior, the other side will be posterior. Okay, and the next is going to be hamstring stretch. So I'm just going to do it bit higher length. So like this. Stand facing the support and try to reach the toes. So they should not be back arching like this. Always maintain extension, that is chest upright and back straight, and try to reach as far as possible. Even if it's this much also fine, but without arching the back. Thanks for watching Fit with Mithraas. Please spread the awareness, and this video is not a substitute for medical advice. Always seek medical help and always do exercises under the professional help. Thank you.